Prior to beginning the activity, please be sure to review the faculty information and disclosure statements, as well as the learning objectives. After listening to the activity, complete the post-test by clicking the Earn Credit link in the episode description. Downloadable slides and resources are also available. The following presentation is copyrighted by Medscape. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of Medscape.
It is the policy of Medscape Education to avoid the mention of brand names or specific manufacturers in accredited educational activities. However, trade and manufacturer names in this activity are provided in an effort to provide clarity. The use of brand or manufacturer names should not be viewed as an endorsement by Medscape of any specific product or manufacturer.
Hello, I'm Dr. Caroline DuPont. I'm a board-certified psychiatrist and addiction medicine doctor and the vice president of the Institute for Behavior and Health. I hope you've had the opportunity to watch Understanding Nicotine Use and Addiction, Nicotine Prevention. This activity will focus on the influence of marketing on youth use of nicotine-containing products. Nicotine is one of the many substances that produce addiction, but it is also one of the most common substances used by youth. Because it is so commonly used by youth, the impact of marketing on youth initiation to nicotine-containing products is a vital topic for us to understand in our work as healthcare providers. Whether you're a physician, a nurse, a pharmacist, or any other provider who works with young people and their families, you have a role in prevention and education when it comes to nicotine. There are two principles that influence youth nicotine use: ease of availability, and decreased perception of harm. Today, we're going to talk about how big business uses those principles to target young users and turn them into lifetime customers. Nicotine products have changed dramatically over time. They fall into two main categories: tobacco-derived and non-tobacco-derived. The traditional tobacco-derived products are less commonly used by youth today due to decades of public health efforts and the work of professionals like you. Here are some examples, but again, these are not the ones people generally start with now, although sometimes after they're using nicotine, they circle back and begin to use these products. Non-tobacco-derived products, particularly e-cigarettes or vapes, are the most commonly used delivery devices for nicotine by youth. Nicotine pouches are now increasingly popular with underage customers. Most of these products are marketed with colorful packaging, sweet flavors to make them attractive to youth. Even the term vape comes from the industry. They are more appropriately called electronic cigarettes or nicotine delivery devices. But the industry chose the word vape because it didn't sound harmful. It even evokes the image of water vapor. What could be safer? There's a wonderful commentary in the Journal of Pediatrics by Doctors Robert K. Jackler and Bonnie Halpern-Fletcher entitled Suggestions to Avoid Perpetuating Tobacco Industry Reduced Harm Marketing Tropes that really digs into this topic. A brief note that when young people initiate substance use with these products, they may not know what it contains. Many e-cigarettes or vapes contain nicotine, but others contain THC, the psychoactive ingredient found in cannabis. I heard from a patient who started vaping at the age of 12. Specifically, it was the flavoring. Her friend told her it was bubblegum flavored, and that was all she needed to know to start using it regularly. She said she initially had no idea that it contained nicotine, but she loved the way it made her feel, and soon she was deliberately seeking out other substances. Sadly, by the time I knew her at the age of 14, she was inpatient for an opiate use disorder. So these things really do have health consequences for our young people. People have consumed nicotine by smoking tobacco leaves for hundreds of years, but it wasn't until the introduction of the pre-rolled cigarette and tobacco-related illnesses emerged as such a prominent way that fundamentally changed public health. With the invention of the manufactured cigarette, the newly created big tobacco industry flourished, and delivered massive marketing campaigns, changing the culture to one that not only accepts smoking, but promotes it. As you can see here, the annual per capita consumption of cigarettes in the US increased from about 49 in 1900 to 1,300 by 1930 to over 3,000 by 1950. And that's the power of marketing. To give you a taste of some of the advertising behind cigarettes, here are several ads from the archives at Stanford University Research into the impact of tobacco advertising. I chose these, which range in date from the 1930s to the 1950s, because they explicitly show medical endorsements of cigarette use by physicians and nurses. That really seems unbelievable now. But I have seen current medical images being used to promote vaping as a healthier choice than smoking cigarettes, or promoting smoked marijuana for medical purposes. So maybe we haven't come as far as we think. It isn't as though the adverse health impact of smoking wasn't investigated during the early 1900s. It actually began in the late 1920s and continued through the 30s, 40s, and 50s, with the mainstream media finally paying attention in the early 1950s. In 1952, Reader's Digest, the most widely read publication in the country at the time, featured an article entitled Cancer by the Carton, putting a spotlight on the health consequences of smoking. The tobacco industry responded strategically, creating the Tobacco Industry Research Committee, or TIRC, whose stated goal was to support research on the tobacco use and health. But in reality, that research was directed to specifically sow doubt about the adverse health effects of tobacco products. This was highlighted by a full page ad put into the newspapers by TIRC in January of 1954 entitled A Frank Statement to Cigarette Smokers. It was published in 448 newspapers across the US. A helpful summary about that frank statement comes from the final opinion issued by a court case filed in 1999. It says, by promising the public that the industry was absolutely committed to good health, the frank statement allayed the public's concern about smoking and health and reassured smokers and provided them with an effective rationale for continuing to smoke. This was then the public relations strategy of the tobacco industry for the next 4 decades. It wasn't until 1964, 10 years later, we had the release of the first ever Surgeon General's report on smoking and health. And that's when the public really made that connection directly, linking cigarette smoking as a cause of lung cancer, heart disease, and other illnesses. Following its release, a wave of changes were made to public health policy, including but not limited to taxes on cigarettes, smoke free air laws, educational media campaigns, restrictions on marketing and sales, lawsuits, and treatment programs focused on nicotine cessation. In the decades since 1964, there have been 34 additional nicotine related reports from the Office of the Surgeon General. Here's a helpful visual with a timeline per capita cigarette consumption and major smoking and health events in the US from 1900 to 2012. You can see that initial growth in cigarette use that we talked about in the early 20th century, reaching its peak just before that Surgeon General's report on smoking in 1964. Thinking about the American cultural support for smoking, many of us can recall when smoking was universal in indoor spaces, restaurants, offices, public transportation, and even airplanes. It wasn't until 2002 that the first comprehensive smoke-free laws that required work sites, restaurants, and bars to be smoke-free took effect in Delaware and then followed by other states. From a public health perspective on creating healthier environments, we've come a long way, but it took a really long time. Why is that? The answer is commercialized recreational pharmacology. CRP is the promotion of products that superstimulate the brain reward system by a for-profit industry. Other obvious legal examples of CRP include the alcohol industry and the growing cannabis industry, which has direct and deep ties to big tobacco. Industry profits are driven by heavy users of these addictive products, where about 80% of a given substance is consumed by only about 20% of users. But the industry targets economically disadvantaged and minority populations, and specifically youth. Targeting young nicotine users is nothing new. This infographic comes from the Stanford Reach Labs Tobacco Prevention Toolkit, which is a great resource for curriculums, lessons, and programs focused on preventing and reducing youth nicotine use. In 1978, the executive of a tobacco company explicitly said, "The base of our business is the high school student." And in 1981 said, "Today's teenager is tomorrow's potential regular customer." The additional note here is that most smokers start as teenagers. That was true then, and that's true today. Nicotine is one of the many substances that produce dependence or addiction because it superstimulates the brain by releasing extraordinary amounts of dopamine. A developing brain is more vulnerable to the effects of this substance. And again, it's the industry's interest to hook those young users early. The American Lung Association reports that among young adults in the US who have ever smoked daily, 87% tried their first cigarette by the time they were 18 and 95% by the time they were 21. Today, initiation to nicotine is not through cigarettes, but nicotine devices like vapes, e-cigarettes, and pouches. But we know that compared to the peers who do not vape, youth who vape are 3 to 4 times more likely to go on to smoke tobacco. This graph here shows that data from the National Survey on Drug Use and Health and compares lifetime, past year, and past 30-day use of tobacco products and vaping nicotine by youth between the ages of 12 and 20. So all of the youth here are under the legal age for nicotine use, which is now 21 across the United States. Over 1/4 of all underage youth have vaped nicotine in their lifetime. And I think it's important to highlight that more than 1 in 10 underage youth are currently vaping nicotine. That means past month use, 1 in 10. Direct marketing to youth has changed from the early days of big tobacco, but not as much as we might hope. Here we do see some old advertisements for actual cigarette toys, strawberry flavored bubble gum, cigarettes that advertise they can be just like dad, and a toy lighter complete with battery and cigarette bubble gum. But marketing of nicotine products to youth still is looking at young people. From magazine ads like the one here promoting social aspects of smoking to digital ads with some of the same past marketing practices of targeting youth and promoting nicotine use as social and sexy. If you look, you will find examples of big tobacco targeting specific groups of people across ages, races, and ethnicities for nearly every kind of available nicotine product. In targeting youth, bright colors and fruity flavors now dominate nicotine products. Nicotine delivery devices are discreet and may serve dual purposes, such as pens or USB chargers, and some devices even have video games embedded where the users are rewarded for the number of puffs they take. Notably, the 2024 National Youth Tobacco Survey reported that more than 85% of youth who currently use e-cigarettes or nicotine pouches report using flavored products. Social media has also become a place of direct consumer-to-consumer marketing, with influencers getting free nicotine devices in exchange for posting about their favorite products. Remember, what is in your feed will not necessarily be the same thing that young people are seeing, as advertising is targeted by age and other demographics. The newest nicotine product gaining traction with youth is nicotine pouches. A 2025 study of 6 brands of nicotine pouches showed that all marketed their products as either tobacco-free, smoke-free, spit-free, or vape-free to increase their appeal and to reduce that perception of harm with these products. Today's products continue to rely heavily on marketing with bright colors and sweet flavors and images of healthy, social, attractive young people. One of the most important things I'd like you to take away from this activity is the long-standing finding in tobacco and nicotine research that young people do not want to be duped by the industry. And the good news from research done by the National Council on Medical Well-being is that youth trust healthcare providers for accurate information about substance use. So I hope you feel armed with more knowledge about both the available nicotine products and the marketing strategies long used by the for-profit industries that target young users. Young people trust healthcare providers for accurate information, but they're not actually very comfortable talking with us about their substance use. Because youth are most comfortable speaking with their friends, peers, and caregivers about substances, we as clinicians can start conversations with our young patients, screen for nicotine at every clinical encounter, and we can educate families and caregivers, arming them with accurate information. We can also support both patients and their caregivers with resources to reduce and plan to stop their nicotine use. Some final thoughts. Supporting nicotine free youth and nicotine free spaces is part of building a healthy community. Everyone has a role in protecting the health and safety of young people, which includes arming them with the information they need to identify when they are being targeted by the nicotine industry and help them avoid unhealthy substance use behaviors. Remember, as a healthcare provider, you are a trusted source of accurate information and someone who is seen as a leader in your community. Knowing what you know now about the marketing of nicotine products and the particular importance of youth nicotine prevention, I've included here some top priorities for advocacy on this issue from the American Academy of Pediatrics. Do you remember how I said at the beginning that there are two principles that influence youth nicotine use: ease of availability and decreased perception of harm? Big business continues to use that to recruit lifetime customers by making these substances easy to obtain and making them appear safer than they are. But we can use that same strategy to arm today's young people against these tactics. Young people do not like to be manipulated by for profit companies. This is a great way to start the conversation about the impact of marketing while talking to young people and their caregivers. I feel outraged by this decades long practice, and today's young people do too. Here are some helpful resources that I believe you will find useful in your work. Thank you so much for all that you do to protect our youth. Have a good day.